Aloha. Jonathan Todd here with MauiForLess.net and an interview with one of my favorite personalities on this island. He's a doctor, but he's such a nice guy. We've had so much fun together over the past year or so that I wanted to bring him to everybody and let you all know what he does. I'm with Dr. Randall Juleff from the Vein Clinics of Hawaii.
Thank you, Jonathan. That's one of the sweetest things anybody has ever said to me.
I mean, for a vein doctor, I wouldn't have thought you'd wind up being one of my besties, but we enjoy ourselves when we go out and have dinner and talk, and you're really, and you laugh when I say it, but you're a font of medical knowledge. You just know your stuff.
Well, I've been reading about this stuff for a long time, so I should know something.
Yeah, and doing a little bit of a practice, too. You have vein clinics really all across the country. You have 4 on Hawaiian Islands. 1 is on Maui. Tell me, people have spider veins or varicose veins. They go, oh, they're just ugly and whatever, don't worry about it. And there's a real health issue here with these, and MauiForLess.net has a way to start taking care of it for nothing, right?
Right. Yeah, that's one of the misconceptions that we have to fight all the time. So many people feel like, I have some varicose veins, they ache me a little bit, but there's no real need to get them fixed. It's just a cosmetic issue. But it's not. It usually is a sign, both varicose veins and spider veins are a sign of a deeper problem with the larger veins in the legs that aren't working properly. And that's a process that we call venous insufficiency.
Once we were having dinner, you went into kind of an explanation of the way that veins work and the gravity and the open-close parts in your veins. Can you explain that to our listeners in its brief, non-technical way? And then we'll go into what you do to fix it. Explain how the veins work, and we'll get to the cure later.
Most people think that, blood flow is based on the heart pumping. And through the arterial side, that's absolutely true. The heart pumps blood to all parts of our body. But in veins, blood in veins doesn't move because the heart is pumping, especially in the legs. Blood is moving because of a couple of different things, but one of the very important things that happens is that there are one-way valves in all of the veins in the legs, and the one-way valves keep the blood moving up back to the heart.
Against gravity.
Against gravity, yeah.
Okay.
And that's an important feature, the gravity, because as humans we spend most of our life, waking hours at least, in an upright position. So the blood in veins is coming back to the heart, but it has to move against gravity. So normally functioning valves in those veins is a very, very important thing.
Let me just clarify that. From a picture, if you had a straw, basically the liquid in the straw, which would be the vein in this analogy, is trying to go up, and then when it goes up a little, the valve kind of closes and holds it there, right?
Right.
And it keeps doing that, like stepping upstairs to get back where it can go down again.
That is exactly right.
So what's happening when that doesn't work that makes a vein either a spider vein or a varicose vein, doctor?
Well, what happens, and most of the time there's a hereditary feature to it. If your mother or your father had vein problems, you will very likely. If both of them had vein problems, it's almost a foregone conclusion. So the one feature that we see time and time again is this hereditary thing, and the hereditary influence is the weak valve problem. So as the valves fail, usually it happens over time and in women after pregnancies and that type of thing. But as the valves are failing, then the blood in those veins is no longer primarily going upward. It now is settling down
pooling into that little compartment.
Exactly.
And it's got nowhere to go.
Right. It pools, it collects in the lower leg, and that pooling of blood then creates the symptoms that we typically see, which are achiness, fatigue, throbbing, cramping, restless leg, feeling of heaviness. You just lose the energy in your legs.
Okay, now from talking with you over a year, you don't have to have the visual signs of the vein problems sticking out or spider veins to have venous insufficiency that we're talking about. You could have no outward signs, but if you have aching, cramping, restless leg, it might be that is the problem, correct?
That is right. And
wow.
that is another one of the misconceptions that we have to fight all the time. You can have perfectly normal looking legs, and you might still have venous insufficiency, which is creating symptoms to a significant extent, such that they may even be interfering with your daily activities.
If you're just tuning in, Jonathan Todd here with MauiForLess.net. I'm with Dr. Randall Juleff. He is a vein specialist on the island and has numerous clinics, 4 on the Hawaiian Islands and then across the United States. I'm not going to go into how many letters he has behind his name and the schooling he's got, but he is really a serious vein specialist. Doctor, what else can you tell us about varicose veins and spider veins? What's the exact difference?
Well, varicose veins are a little bigger. They're a little deeper, under the skin, although you can see them. They're not too deep not to see. Whereas spider veins are tiny. They're a little web-like. That's why they call them spider veins. And spider veins are actually in the level of the skin. They're, in the skin.
So if you rub your hand over your leg and you feel a bump, you have a varicose vein.
Right.
And if you don't necessarily feel the bump, but you see what looks like cracked glass or a spider web, then those are spider veins.
Absolutely.
How do you fix spider veins? That's the easy one, right?
Spider veins are pretty easy, yes. Typically, it's important that we see the patient and we evaluate them, usually with ultrasound, which is a very quick, painless type of evaluation. And we want to make sure that they don't have that underlying problem that we've talked about. But once we figure out that they haven't or we've fixed it, then spider veins, we call it cosmetic injection sclerotherapy. Pretty quick, nearly painless, and we do a very good job at eradicating the visualness of spider veins.
And sometimes you can do that in one session. Depends on how much they have on how much of their leg area, but
sure,
it's sure worth looking at and trying to figure out who your ally is here. And I'm telling you, we've looked at a lot of different doctors. This is the one who's recommended by everybody. It's Dr. Randall Juleff, Vein Clinics of Hawaii. Doctor, last words?
Well, I like to do this type of thing because, we've talked about several misconceptions and getting the word out as far as how we can help people about a problem that they may not even know they have or what it's due to, but it's an easy fix. We do it every day of the week, and it's good to get the information, the education
Wonderful.
out there.
I'm Jonathan Todd for Maui for Less. This has been Vein Clinics of Hawaii with Dr. Juleff. Thank you so much for being here, Doc.
Thank you, Jonathan.
Aloha.